All right, good morning, everyone. Today we are reporting 143 new COVID-19 cases. We have 4 new hospitalizations, as well as 1 new death that is part of this. We have 44 new individuals who have recovered from COVID-19, and we're adding 560 new negative tests that have been performed. In total, we have 1,311 COVID-19 cases. This does include 55 hospitalizations as well as 7 deaths. In total, we've had 373 individuals recover from COVID-19 in the state and are reporting a total of 9,239 negative tests that have been performed. We have no updates to the community impact map for today. The new death that we are reporting is a Minnehaha County resident, and the range of ages of our COVID-19 deaths does include, we now have 2 individuals in the 50 to 59 year age category, 2 individuals in the 60 to 69 year age category, 1 person in the 70 to 79 year age category, and 2 individuals in the 80 to 80 and older category. In total, we are reporting 4 deaths, 5 male and 2 female. And then by county, our totals are 2 deaths for Beetle, 1 for McCook, 2 for Minnehaha, and 1 for Pennington. The updates that we have also include, of the 1,311 COVID-19 cases, this does include 598 individuals that are part of a cluster associated with Smithfield. And this also includes 135 cases of those cases that have resulted from close contacts within that cluster. 80 of our new cases are employees associated with the cluster. And in total, for our new cases, we have 1 in Hamlin, 1 in Gerald, 1 in Lake, 6 in Lincoln, 131 in Minnehaha, 1 in Moody, 1 in Pennington, and 1 in Yankton. The age range for our new cases, we have 14 individuals in the 0 to 19 year age category, 28 in the 20 to 29 year age category, 36 in the 30 to 39 year age category, 30 in the 40 to 49 year age category, 27 in the 50 to 59 year age category, 7 in the 60 to 69 year age category, and 1 in the 70 to 79 year age category. Of the new cases, we have by sex, 75 of them are male and 68 of them are female.
Thank you, Dr. Clayton. I've unmuted the line and we'll take your questions.
Mark from the Black Hills Pioneer.
Go ahead, Mark.
We have people getting tested by physicians who obviously deem the test necessary, put into the lab, and we're being told that the labs also have the discretion to test or not test based on that patient file. Can you speak to that at all?
This is Josh Clayton, and that is not information that we have been hearing. The information that we have is that individuals who are identified by their physician or other medical provider are able to receive testing, and we are continuing to see individuals being tested in all corners of the state.
This is Kim Elson-Rice, and the one thing I would add is that the State Public Health Laboratory is only running tests for high priority populations, and that's out on our website, and that's been in place now for some time. So I think the answer to that question depends on perhaps what lab that provider is using. And if they're sending it to the state public health lab, those specimens are limited to the high priority populations.
All right, next
This
question.
is Stephen Gross from the AP.
Go ahead.
Stephen from the AP. So I was wondering if you could tell us a little bit about the mechanics of contact tracing, and if you are overcoming language barriers with that. Are you using interpreters or a service or anything like that?
Yeah, so as we do with all of our positive COVID-19 cases, we do have staff that are focused on getting a hold of that individual, and that can be a simple phone call, and that may also, depending on the needs of the individual, may require us to use an interpreter. And so we do have interpreter services that are available via phone, so we can contact these individuals and make sure that we're relaying the information about their diagnosis, which usually it's the second time that they're hearing that information. The first time is when their clinician contacts them. The individuals are then provided the information about staying at home. We collect their close contacts, talk through any issues that they may have in adhering to that isolation, and then make the appropriate referrals for different services to make sure that they're able to safely stay in their home. Then the same staff are also turning around and making calls to individuals that are close contacts of that positive COVID-19 case, and making the information, to make sure that they understand that they have been a close contact to a COVID-19 case, that they understand that they're to stay at home for 14 days after their last exposure to the COVID-19 case, and then also making any additional referrals or notices to employers to help make sure that that there's an awareness that this individual is being asked by the Department of Health to either isolate to home or to quarantine to home, based on which they're either a close contact or a COVID-19 case.
Next question.
So with the
This
Argus
is Joseph
Leader.
from the Capital Journal, please.
I heard the Argus Leader first.
Yep. Just wondering, now that the CDC is on site at Smithfield, when is the state expecting to have the assessment in hand, and kind of what are the next steps in the process at this point?
So we are continuing to work with the team on the ground there, and we're receiving daily updates from them. It is a process that we're going through to make sure that we have all of the information available to the team. Smithfield Foods has been working very closely with us from the beginning of having their first case identified in their facility, and continue to work very closely with our team on the ground. We do not have a specific timeline to have recommendations finalized, but just know that we are working toward that as a goal, and that the team is doing so under a timeline that they need to make sure that they have all of the available information to make solid recommendations.
Okay.
The next question I heard was from the Capital Journal. Yes, y'all. Good morning. Thank you. I was wondering about so Harvard Medicine is starting a new study concerning the tissue plasminogen activator. Is there, with all three of our states' medical folks working together, are they is that another opportunity for South Dakota to also try that? Because while I realize that the chloroquine is, they're trying to see if it'll be prophylactic and direct away from, but treating the actual people that are sick, it looks like this could have a lot of impact with the declotting with what they're seeing and stuff.
Yeah, and I think the current focus is on looking at any sort of therapeutic that would be helpful to treat either patients that are infected with COVID-19 or those who are close contacts and are at risk of then developing COVID-19 infection. And so I would say that yes, the focus is on looking at all of the advancement in either prevention or treatment to make sure that we're taking care of South Dakotans as best we can. The specific focus then would be on that those treatments and those exposure prophylaxis would come from the facilities specifically. So yeah, just know that there's a continuing focus on making that information and treatments available to individuals in need of that.
Next question.
Naima Casing, Elkland Independent.
Go ahead.
Yes, my question is, this is wonderful that things are picking up, but what is going to happen in terms of, even though we don't social distance lockdown, what's going to happen in terms of masks? I know I've been researching this very, very strongly, and I don't see that the people, especially like with Smithfield, are going to be able to get masks. It could be 5,000 people in Sioux Falls. I'm just wondering what's going to happen there.
So this is Kim Elson-Rice, and part of the assessment that is happening right now includes what personal protective equipment the individuals working at the Smithfield plant have available and what they need to stay safe. And so if masks are part of the recommendations, then that would be something that we would incorporate into the recommendations moving forward. There's also other protective equipment that we'll make sure is assessed in terms of the needs of that population, but that's definitely within the scope of the assessment that's happening right now.
Well, and I had the information. Who do I send that to? Because I think it's very important.
You can send that to Derek Haskins.
Sure.
Okay, I will do that. Thank you.
Next question.
Yeah, Benjamin Chase
Stephen
with
Grubb from the
Plainsman.
AP.
The Huron Plainsman, I think I heard.
Yes. My question is, looking at the numbers that have been posted to the web, we have 7 deaths, and that's been recorded everywhere except for the deaths by county. And I'm just curious if you can identify the county that the death has been, the new death is from.
Yeah, the new death occurred in Minnehaha County.
Okay, thank you.
Yep.
This is Stephen
We'll
from
make
the
sure
AP.
that's reflected on the website as well.
Thank you.
Next question.
This is Stephen from the AP.
Go ahead, Stephen.
I know we had previously discussed breaking down cases along race or ethnicity, and I wondered if you guys are doing that, if that's available, and if you've seen discrepancies in terms of population percentages and if it's affected certain races or ethnicities disproportionately.
So you are correct that we continue to review the impact of COVID-19 on the state's population, and do look at who is impacted more. So at this time, most of the cases that we're seeing are really occurring at 20 to 49 year age category. The vast majority of our cases are reflective of that, and I think that's also signs of number one, that individuals who are at that greater risk are focusing on staying at home and decreasing their risk potential of being infected with COVID-19, and is also reflective of our lower hospitalization rate overall as well.
So in terms of breaking it down along race or ethnicity, are you doing that? And have you seen certain races or ethnicities disproportionately affected?
Yeah, we also do the breakdown by race and have not identified any particular concern. One of the things that we are looking at is given some of the population that we're seeing a little bit of over representation, I should say, in our Asian American community, but that is the only thing that we're seeing at this time.
Is it possible to get that?
Next question.
Hi, it's Hannah from CBS News.
Go ahead.
I just wanted to make sure I heard the numbers right about the cluster out of Smithfield. Is the total number of cases connected to Smithfield now 733 total?
That is correct.
So it's, I'm sorry, just to make sure I have it. It's 598 individuals who were employees and 135 close contacts?
Yes, that is correct.
Okay, thank you. Are you able to break down the number of hospitalizations and deaths that are connected to Smithfield? And my second question is, are you considering testing, widespread testing of food plant workers in particular in order to get Smithfield back up and running?
So the focus on testing is testing of symptomatic individuals within the workforce. And so, we are not focusing on doing asymptomatic testing at this time. Overall, we do have, we do focus on our numbers by statewide for, our overall hospitalization and so on. And so we have 55 individuals who have ever been hospitalized, as well as 36 individuals who are currently hospitalized.
This is Morgan at the Rapid City Journal.
Go ahead, Morgan.
I just want to go back to what Steven said. Can you release racial data or ethnicity data? Because a lot of the Smithfield people are not white. It's a lot of immigrant and refugee workers.
Yeah, we are working on that as a breakdown to be able to share. As I said, it is something that we do look at within our data internally, and are looking for ways to best share that.
One final question.
Do you have a timeline on that?
One final question.
This is Carol Eggers with NBC.
Go ahead.
Will you break down, of those 135 contacts at Smithfield, will you be able to break down how many of those were household contacts versus contacts in the community?
We definitely look at that data internally, but that is not information that we are releasing.
Just a follow-up, you said you contact employers. Would you be able to release information on how many employers you've contacted as a result of those 135 contacts?
So what we do is we focus on when we have an exposure in a workplace that extends beyond our ability to know who came into close contact with a case of COVID-19, and then we do issue public notices for those employers, but otherwise we do not release individual employers who have a single case. Again, I think the focus here has to be on, we are seeing, community transmission in a large number of our counties, and so it is expected that a large proportion of those who become infected are going to be workers. So the one thing to be aware of is, there's while there is potential risk within workplace settings, we are working to mitigate that through our containment measures of isolating cases to isolating COVID-19 cases to home, as well as working with those who are close contacts to have them stay at home as well for the 14-day duration.